Good morning. This is Maren Allen from OD. We are very delighted to have our colleagues here and also to have so many people from across the department and the agency joining us by webinar. And we are looking forward to seeing the results of the PIAAC survey of adult skills and starting to think about the impact that that may have for all of us. And I know that there are many people who have been tracking on this for many years and are excited about having new data to discuss. So, Bill, do you want to introduce our colleagues?
Thank you so much, Maren. I've been so looking forward to this presentation because as we within NIH are looking at the next generation of health literacy research and how best to stimulate it, one thing that I've noticed when I look at our portfolio is we have funded so many successful grants, but projects that look at the health literacy of this and or that, and not necessarily health literacy within the context of overall human literacy. So we've had too many delays in bringing up the audiovisual, so why don't I turn it over to you three and let you take it away and introduce yourselves as you each present your piece.
This is Stephen Probosnik. I'm from the National Center for Education Statistics, where for the original round of PIAAC, I was one of the national program managers and am now PIAAC technical advisor. I'm just going to go very quickly to place PIAAC and contextualize where we're at, and just kind of give you a quick recap. As many of you are probably aware, this is a report that came out last October 2013 during the last shutdown of the government, and that was our first look in which we released the results from PIAAC, the Program for International Assessment of Adult Competency, that compared how well the U.S. did with other participating OECD countries and a couple non-OECD countries. And the results, as you probably are aware, were not stellar. This quickly is a recap here of the three domains that are used: literacy, numeracy, and problem-solving in technology-rich environments. The colored bars that are above the U.S. list the various countries that did better than the U.S. in these three domains. The U.S. is colored orange on my screen here, and is in a pack of countries that are white. The countries that are white are not statistically different than the U.S. performance, and as you can see, the U.S. is below many and most of the countries in a couple of the domains, and indeed is below the international average in literacy, numeracy, and problem solving. That's what we found out after the results of 2012, which was the first round of PIAAC, and it was administered to 16 to 65-year-olds, a sample of 5,000, all conducted in English, and again was conducted on computers that we took to people's homes, knocked on their doors, and remarkably were let in generously, and people took 1 hour of their time to answer background questionnaires and another hour of their time to take the cognitive questionnaire, and they did that with a 70% response rate in the United States. Not quite as well in the other countries. There were 22 other countries that participated, 23 total, but not only, I think only other one country was as high as the U.S., but quite well. Here's the timeline. I've just recapped 2012, and in 2014 we went out again in the United States for what we call our national supplement. We went out again because we realized that the 5,000 adult sample in 2012 was not sufficient to really dig down in a couple of populations. So we oversampled for three populations: young adults, 16 to 34-year-olds. We also oversampled for unemployed, and we added an additional sample of adults who are older than the PIAAC range, and we got adults who were 66 to 74. 9 other countries also sampled at the same time and are being added to the international data, or PIAAC. In 2017, the U.S. is going to go out again, and we will have a second supplement as well as a new nationally representative sample. That is to say, the 2012 and 2014 were designed to be combined. There is only one data point there. You cannot analyze the 2014 data by itself. It's an oversample supplement to 2012. But the 2017 will be will be possible to combine with the 2012, 2014 in order to have small area estimates. And part of the purpose of going out again is to be able to provide county-level estimates in the U.S. to replicate what was done in the last National Adult Literacy Survey in 2003. But in addition, 2017, 2018 will be another nationally representative sample for the U.S. The 2021 will be the next international administration of PIAAC. That will be, again, organized by the OECD. So just to clarify, 2012 was organized by the OECD. 2014 and 2017 are U.S. efforts to collect more data to expand the PIAAC data just for the U.S. Those can be compared internationally because the variables are all the same, but we're not done in the same way in the other countries. What the National Supplement included here that describes the oversample that I just described, young adults, unemployed, and older adults, was about 3,600 more adults added. But in addition, in the U.S., we went and did a prison sample of incarcerated adults aged 16 to 74. We drew a random sample of 100 prisons from federal and state lists. 98 participated. And in the end, we had a target of 1,200. In the end, we got a little more than 1,300 incarcerated persons of a stratified sample that was designed so that we would make sure we would have groups of interest, including for the first time to have sufficient sample for female as well as male prisoners. The back questionnaire that was used for the National Supplement was exactly the same as what was used internationally, but for prisons, we modified it somewhat to have questions that were specific for the incarcerated population and to accommodate questions that we collected from Bureau of Justice. Here's a quick recap you can look at that summarize the numbers I just said, as well as main areas for the background questionnaire, which again is very extensive both for educational information, experience, variety of skills that people use, as well as background information. Forthcoming reports. NCES is going to be releasing next year, in sequence 3 reports. One is the next first look report to summarize the oversample, and that will basically be very large overall averages with the release of the data so that people can compare and know that their analysis is correct. That will be followed by 2 in-depth reports. One, looking at the incarcerated adults. That will be the prison report, sometime coming out in late spring, followed by an in-depth young adult report, which will look particularly at employment and skills of young adults. That will be coming out in the summer of next year. I'm going to turn over the mic now to Heidi Silver-Paquilla, who is my colleague, and we are delighted to have her at NCES on detail from, and I'll let you explain.
Yes, good morning. It's been my privilege to be on detail at NCES this summer from my home office of Career, Technical, and Adult Education. I've been working to make skills everyone's business this summer. And so very happy, and thank you very much for working with me, Erin and Maren, to get this scheduled. We're going to talk fast. You have all the slides, or we'll get them out to you, everyone who is registered. And we want to make sure we get time for discussion so that you can think together about how this makes sense for your work and how we can work together. So some of the key findings, health findings, were that there's a very strong link between literacy and self-reported health status in the United States. We're at the top of this chart. And the diamond off to the right is showing that for level 1 or below in literacy, individuals are 4 times more likely than their more skilled peers to report poor or fair health. So, and we are way out of line with the international average, that our health is stratified by literacy. And this slide shows that in a different way This is compared to the international average. Who's reporting excellent or very good health? And this, to me, raises a lot of questions when I think about your Institute of Medicine report, Shorter Lives, Poorer Health. What, don't we know that we have shorter lives, poorer health? We're not. There's just so much interesting things to think about when Americans are rating themselves higher than their international colleagues, when actually our numbers are so much poorer. So lots to think about there. This is confirming information for you. We knew from the null that low literacy and poor health were related. This is updated numbers for you. You can see that folks with very good and excellent health have higher literacy, and that's true internationally as well. And the next one is the same, second side of the same coin. This is numeracy. All the NCES data reporting is color-coded very helpfully. So green is always numeracy. I know that you've been focusing on numeracy over the last few years and how important it is. Not only do we see the same pattern of folks with low skills in numeracy reporting fair or poor health, look how low our numeracy numbers are. Stephen shared that we tested overall very poorly, but at every level, at every age level, the U.S. just did very poorly in numeracy, and it's something we really need to think about. This is a different way to see that data, and this is by gap. So when we're looking at blue literacy here, the U.S. scores are similar to the international average by gender at the left, smaller by age, which is a different problem. Our young people are not pulling ahead. You can see that our young people, the blue diamond, are not reaching the international average for young people. So that's a different problem. But our health over on the right has that big gap, right? We're out of step with how health looks as in relationship to skills. And again, I'm going to show you the numeracy, which is just the same data, but in numeracy, same kind of findings. Age and numeracy is pretty alarming here, and numeracy and health, pretty well below the international average. A couple slides that are hidden in your slide deck, but I want to jump ahead to this one, which is another alarming gap. This is the gap between literacy scores by parents' educational level. So we interviewed adults, 16 to 65, and asked what their parents' educational level was. By their parents' educational level, you see that those who had neither parent had attained a high school credential, that's the horizontal bar, way below the international average. Okay. Our average, which is the dot, is also below, and our diamond is also below the international average. But the gap is the inequality that we experience in this country. And I think about this in terms of the census data that just came out and the intergenerational poverty that we see so clearly there. We're working up a parental education presentation to really examine this data and how this rolls out in other experiences, in their earnings over a lifetime, in their job stability, in their educational attainment, all of that, and that will be coming up this fall on the public website that Jale's going to talk about. But this is something that I think would be of great interest to many of you. And for example, I know that HRSA just came out with an innovation challenge to address the 30 million word gap of young children in poverty, and that's the kind of thing that could really make use of this data, and it's a point, I think. So with this depressing news, I'm going to move on to some of the questions that are in the background questionnaire. I'm just going to show a couple, but thank you. But know that there are more in the background questionnaire. It's very extensive. And I make the point that the background questionnaire was asked in both English and Spanish. As Stephen said, the assessments themselves were only conducted in English. So we see quite low literacy among Hispanics, for example. That's their English literacy and numeracy. And, of course, you need a lot of literacy to answer. So the background questionnaire is quite extensive, and it's just ripe for mining. There are several questions on each of these bullet points here, and I'll just show you one further. So we've got data like this about health behaviors, not only about do you have insurance, but here are some behaviors. We have questions about are you out of work because of your health or disability. So there are several hidden slides in the interest of time, but lots of information for you all and for your grantees to mine. And I want to give Jaleh a little time to talk about the tools that are available. So I'm turning it over to Jaleh Swery from AIR.
Good morning, and thank you for inviting us. I will be talking about, I'm from AIR. I have been working on PIAAC over the past 5 years with Stephen, and a few months now with Heidi. Okay, sorry. The main page, NCES homepage on PIAAC provides information on the most recent publication and all the publications that have been put out by NCES. Also, there is a portal on this site, on NCES site. This is the second bullet, which provides provides a simple search tool for people who would like to find out about different variables, the relationship between variables and skills. The third bullet is a data explorer. It's a more extensive search tool, which in addition to providing information between relationship between variables and skills, it also provides significant tests and standard errors. So it's a little bit more sophisticated tool that researchers can use and immediately get different formats of the results in graphs, in tables, and they can export it to Excel file. Another resource, these are sample resources we are talking about. There's so many resources out on PIAAC now. This is Education and Skill Online that was developed by, it's a tool that was developed by OECD to provide individual level results that were based on PIAAC skills. It is measuring both cognitive and non-cognitive skills. It includes a short background questionnaire, and then the cognitive skills are the same as the one we had in original PIAAC, which is literacy, numeracy, problem solving, and reading components. And non-cognitive module includes skill use at work and home, the education and job experience, as well as subjective well-being and diet and health. Both the Education Skills Online background questionnaire and cognitive, and not all of the modules are both in English and Spanish. So there are 11 Education and Skills Online is available in 11 languages, but for the U.S. is only English and Spanish, of course. Individuals can go online and access the test and measure their skills. So it's good for organizations, for community colleges that want to measure the skills of pre or post the skills of their students, for employees who want to find out what would be the best way of providing the type of training or education that they have to provide to their employees. And also states could also implement, conduct this assessment, use this tool to find out about specific population in their state. One of the major other resources is the PIAAC Gateway, which includes, it's a focal place for all PIAAC-related information. It has information on research papers, national and international research papers. It includes information on conferences on PIAAC. There are a lot of infographic, what do you call it? Infographics, anyway, that you can download and on different skills, and you can download and use. Also, it has information on the media. Another resource? This is the list of resources that are right now available. We are providing, we had a grant from IES that we are providing training for researchers on how to use PIAAC data. PIAAC data is very complicated, so researchers who want to use it, they would benefit from going through these trainings. There are extensive 3 days trainings as well as 1-day trainings that will start in 2016. And information about these trainings will be posted on the gateway. So if you have researchers in NIH who are interested, or no researchers are interested, please direct them to the gateway. There are also, we provide the research question and answer section on the gateway that responds to the technical questions researchers have about PIAAC data. Also, NCES has developed an online training module which gives information on, which is 5 modules that people can go on their own pace and find out about how to use PIAAC data, the structure of the PIAAC data and how to use it. And also we run statistical codes for researchers who cannot access restricted use files, and especially this is from people who are not in the U.S., residing in the U.S. These are the sample of research papers that we recently funded, and one is coming up which is related to health, and it's literacy and fertility across OECD nations. And we had 2 other papers which were directly on health literacy that when you go on the gateway, you can find out more about.
So I'd like to thank all of you, our distinguished guests, and for everyone's feedback and intellect and time. And we will follow up with the action items that we discussed here at the end and throughout the day. Look forward to getting that full slide set from Heidi or one of us. Thanks so much, and have a great week.